I'm TRACY GRANZYK, Director of the Center for Healthcare Narratives at the MedStar Institute for Quality and Safety, and founding editor-in-chief at Please See Me, an online literary magazine for healthcare narratives striving to elevate the voices and stories of vulnerable populations. I'm here with my MIQS colleagues, MARTY HATLIE and ARMANDO NAHUM. MARTY, why don't you introduce yourself now and share a few words about the importance of this series?
Hello, I'm MARTY HATLIE, patient safety advocate and currently the president of Project Patient Care, which is a Chicago-based nonprofit dedicated to including the voice of the patient in healthcare improvement work. I also work closely with Armando to build patient family advisory councils focused on safety and quality in hospitals and systems throughout the country. That organization is called H2PI. Armando will say a bit more about it. I also serve as co-director of MIQS, where I have the good fortune to work with TRACY, Armando, and other change agents to prevent harm and advance safety in healthcare. I see patient safety as a public health issue, just as COVID is. COVID underscores that we're all in this together, by which I mean both providers and users of care are at risk of COVID. We have a joint opportunity to work together to develop and embed prevention strategies, and that begins with sharing our experiences. This series exemplifies working together in an all-teach, all-learn way to inform solutions, and that's a beautiful thing to do.
Thank you, MARTY, and thanks for joining us today. Armando, would you like to introduce yourself?
Thank you, TRACY. Hello, everyone, and welcome. My name is Armando NAHUM. I am the CEO of Safe Care Campaign, which is an organization dedicated on infection prevention after the loss of our son, Josh. I'm also a principal at H2PI, the Healthcare and Patient Partnership Institute with MARTY HATLIE, and I have an appointment as Director of the Center for Engaging Patients as Partners at MedStar Institute for Quality and Safety. You know, 14 years ago, after we lost our son, some very smart and important people advised me that storytelling can change culture. Well, we certainly have made a lot of progress in the last decade, but COVID-19 brought us a new challenge and made us realize how much more work is needed. That is why we are here. So for this project, I will wear a different hat. I will sit in the background playing producer, director, or editor, and just making sure the recordings go smoothly. Again, thank you so much for your participation. TRACY, do you want to take it away?
Thanks, Armando, and thanks for handling the technical end of this effort as well. The Center for Healthcare Narratives was really established based on a portfolio of narrative films and stories that we've created over 10 plus years. And we really believe that these stories have helped influence a positive culture change in medicine. Whether the setting is medical or nursing education or large health systems working toward a high reliability culture, our teams have experienced repeated anecdotal success when using stories to carry our messages of the need for change. This series of 5 short films was created to document the pandemic, as well as connect those who may be suffering physically, mentally, or emotionally during this time. We called upon 9 global patient safety and quality experts who enthusiastically came together to answer 4 questions during the early days of the COVID-19 quarantine. The first film includes panel introductions. You'll get to meet the entire panel. And each successive film includes each member responding to one of 4 questions. Those questions include, number 1, how the COVID-19 pandemic has affected you personally and professionally. Number 2, each panel member will share stories that they've heard or experienced during the COVID pandemic, and they don't want us to forget. These are stories that have left a mark on them for the rest of their careers. Number 3, what will this time teach us for the future of healthcare? And finally, number 4, what technology or innovations look promising and transformative for the future as a result of the COVID-19 pandemic? Watch the films in succession or meet the panel and choose to hear responses to the questions that most interest you. Thank you for your interest, and please reach out to share stories of your own during this difficult time. Take good care.